clinical skills, but also the knowledge he has been able to pass on to the fellow health workers, creating a wider impact on the healthcare delivery across the region. However, he continues and notes that continued investment on training health professionals and equipping hospitals with modern medical equipment remains essential for sustaining the improvements in the emergency healthcare services throughout Uganda at large. Now, Zikusoka has expressed the gratitude to the partners behind the fellowship program, saying that the opportunity has transformed both his professional career and the quality of emergency care now being provided at Masaka Regional Referral Hospital, ultimately giving more patients a better chance of survival during the medical emergencies he gets to encounter. Now, moving on from our story from Masaka Regional Referral Hospital to another one. Now, over 22,000 Ugandans benefit from the free medical camp supported by DFCU Bank and Rotary Uganda. Now, this has now 222 Ugandans have received free medical care through a health outreach program jointly implemented by the DFCU Bank and the Rotary Uganda, bringing essential healthcare services closer to thousands of people living in the underserved communities across the country. Now, the achievement was announced by the DFCU Bank and the Rotary Uganda when it celebrated the first anniversary of the Rotary Club of Kampala Blue Hats and Uganda's first corporate Rotary Club during an event held at the bank's headquarters in Nakasero. Now, since the partnership was launched in 2025, the two organizations have organized quarterly medical camps in different parts of the country, providing free screening, diagnosis and treatment for a wide range of illnesses. Now, the camps have offered services for non-communicable diseases such as diabetes and hypertension, as well as testing for cancer, screening, HIV testing and counseling, sickle cell disease management, maternal health care, eye care and dental treatment, enabling thousands of Ugandans to access services that many would otherwise struggle to afford. Now, one of the program's most significant achievements has been facilitating 22 life-saving heart surgeries for children from the Western Uganda. And the surgeries have provided specialized treatment to children born with heart conditions, giving many families a renewed hope and a chance for healthier futures. Now, the healthcare initiative is supported through the DFCU's Bank 1 billion shilling commitment over the 3 years towards the Rotary Uganda's health programs. Now, the investment is aimed at expanding access to preventative health care, specialized treatment and community-based medical services across the country. Now, speaking during the anniversary celebrations, DFCU Bank Chief Executive Officer Charles Mudiwa said that the partnership demonstrates the important role of the private sector and which it can play in improving healthcare delivery and addressing challenges faced by the vulnerable communities. Now, Mudiwa noted that over the past year, the partnership has enabled more than 22,000 people to receive free medical services through quarterly outreach camps, improving healthcare access while saving lives across the different regions of Uganda. Now, he says that the next phase of the program will focus on establishing sustainable health and the wellness systems that continue serving the communities even after the medical outreach camps have ended. Now, according to Mudiwa, the Rotary Club of Kampala Blue Hats has also created an opportunity for employees of DFCU Bank to volunteer their professional skills, knowledge and time in initiatives that directly improve the lives of Ugandans. Now, the anniversary celebrations also marked a leadership transition within the Rotary Club of Kampala Blue Hearts, with Bernard Kasibante assuming office as the club's president for the year 2026 to 2027 Rotary year. Now, Kasibante pledged to strengthen community service projects, build stronger partnerships with development organizations, and expand initiatives aimed at improving health and education and livelihoods for communities across Uganda. Now, he says that the Rotary leadership is centered on selfless service, creating opportunities for the others, and building stronger communities through the collective action and volunteerism gathered together. Now, the Assistant Governor, Stephan Sendi, praised the collaboration between the DFCU Bank and the Rotary Club of Uganda, saying that it demonstrates how the partnerships become the private sector and service organizations can help bridge the gaps in the healthcare delivery and contribute to the sustainable national development. Now, he added that the Rotary Club of Kampala Blue Hearts has become an example of how corporate organizations can mobilize both financial resources and human capital to support the impactful community development programs. So, as the partnerships enters its second year, DFCU and Rotary Uganda says that they intend to expand the medical outreach programs to reach even more communities across the country, while investing in the long-term health and wellness systems that will continue improving the healthcare access for Ugandans beyond a periodic medical camps they provide. Now, from that inspiring story, moving on into our next story for today. Now, health experts raise concerns over the rising congenital heart defects in Uganda. Now, health experts are raising concerns over the increasing number of children being born with congenital heart defects in Uganda, with specialists attributing many of the cases to poor antenatal care attendance and the missed maternal vaccinations during the pregnancy. Now, the concerns were raised following a week-long cardiac medical camp organized by the Uganda Heart Institute in partnership with the Jinja Regional Referral Hospital, where 17 children successfully underwent life-saving heart surgeries. Now, according to the Deputy Executive Director of the Uganda Heart Institute, Dr. Peter Rambi, cases of congenital heart defects, particularly conditions commonly referred as holes in the heart, have continued to rise over the past few years, placing an increasing burden on families and the country's healthcare system. Now, Dr. Rambi says that one of the major contributing factors is the failure by some expectant mothers to attend regular antenatal care visits. Now, he explains that some women who miss the antenatal services also miss the important health education and the routine vaccinations that help protect both the mother and the unborn child. Now, he notes that one of the most critical vaccines is protection against the rubella, a viral infection that can have devastating effects when contracted during pregnancy. Now, according to the specialist, rubella infection is in the expectant mothers is strongly linked to the congenital heart defects and other birth complications in the newborn babies. Now, Dr. Rambi explains that one of the most common conditions treated by the institute is the patent ductus arteriosus, commonly known as PDA. Now, this occurs when a blood vessel known as ductus arteriosus fails to close after childbirth, and it is before this happens close after the birth, as it normally should. So during the pregnancy, the ductus arteriosus plays an important role by allowing blood to bypass the baby's lungs while still in the womb. So after birth, the baby begins breathing independently, so the vessel is expected to close naturally. However, when it remains open, it causes abnormal blood flow between the heart and the lungs, making it difficult for the heart to function normally. So this condition is more common among babies born prematurely whose body systems may not be fully developed. So however, maternal infections such as rubella during the pregnancy can also interfere with the normal heart development, increasing the likelihood of the congenital abnormalities. Now, health experts say that rubella infection does not only affect the heart but also lead to other serious complications, including to the cataracts and hearing impairment and poor growth among the affected children. So while acknowledging that not all the congenital heart defects can be prevented because some result from the genetic abnormalities or the development errors during pregnancies. Now, Dr. Rambi emphasized that proper antenatal care plus the routine maternal screening and timely vaccination remain some of the most effective measures for reducing the preventable cases. And meanwhile, the Uganda Heart Institute has announced plans to expand specialized cardiac care services beyond Kampala in an effort to improve access to the treatment across the country. So as part of the long-term strategic plan, the Institute will establish regional heart treatment centers, with one of the first facilities planned for Jinja Regional Referral Hospital. Now, according to Dr. Rambi, the government has already allocated 2 areas of land where the regional cardiac center will be constructed, bringing specialized heart services closer to the patients in the eastern Uganda and the neighboring regions. So the director of the Jinja Regional Referral Hospital, Dr. Yali Alfred, says that the planned cardiac center will significantly reduce the referrals to Mulago National Referral Hospital, easing pressure on the country's main referral facility while lowering transport costs and treatment delays for some patients. Now, Dr. Yali also revealed that the decisions and the discussions are underway to strengthen the capacity of healthcare workers through the specialized training in diagnosing and managing heart diseases, ensuring more patients receive timely treatment closer to their homes. So he commended that the government of Uganda and the Ministry of Health for investing in the critical healthcare infrastructure, including the intensive care units and oxygen plants, which have enabled the hospital to host specialized surgical camps, such as the one recently conducted and concluded. Now, Dr. Yai says that a Jinja Regional Referral Hospital intends to continue hosting annual cardiac medical camps until the regional heart center becomes fully operational. Now, health experts believe that strengthening preventative health care and improving maternal health services and expanding specialized cardiac treatment across the country will play a very critical role in reducing the growing burden of the congenital heart disease, particularly in the high-risk regions such as Busoga. Now, coming in from that story, moving on to another. Now, the Ministry of Health flags off maternal and newborn care equipment worth shillings 2.1 billion. Now, the Ministry of Health has flagged off a consignment of maternal and newborn care equipment worth approximately 2.1 billion shillings to strengthen emergency obstetric and newborn care services in public health facilities across Uganda. Now, the equipment was officially flagged off by the State Minister for Primary Health Care, Dr. Charles Ayume, who said that the investment is aimed at improving the quality of health care for mothers and newborn babies, particularly in the high-volume health facilities where the demand for maternal services continues to increase. Now, the medical equipment was produced by the Rotary under Empowering Families Growing Futures, an initiative that will be distributed to the 31 public health facilities across the 14 districts. So the beneficial facilities include 16 health center and center 4s and 15 health center 3s, which provide essential maternal and child health services to thousands of Ugandans every year. Now, according to the Ministry of Health, the equipment packaged includes the delivery beds, radiant warmers, patient monitors, baby costs, phototherapy machines, newborn respiration units, kangaroo mother care chairs, and other essential medical equipment required to improve maternal and newborn survival. Now, speaking during the flag-off ceremony, Dr. Charles Ayume commended Rotary for its continued partnership with the government in strengthening healthcare services across the country. Now, he emphasized the ministry's commitment goes way beyond supplying medical equipment, noting that equal attention will be given to ensuring that equipment is properly utilized through the continuous training and health worker and also the regular supervision and proper maintenance. Now, the minister said that providing modern equipment without adequately trained personnel would not deliver the desired improvements in the maternal and newborn health care, stressing that building the capacity of healthcare workers remain the key priority. Now, also speaking at the event, the Commissioner for Reproductive and Child Health at the Ministry of Health, Dr. Richard Muganyi, said that the donated department complements ongoing government efforts to strengthen emergency maternal and newborn health care services. Now, Dr. Mugahi noted that health workers serving under the program are already undergoing specialized training in essential newborn care to improve the quality of services offered to mothers and babies. Now, he added that additional training under the Helping Mothers Survival Program will equip the health workers with advanced skills to effectively manage the life-threatening obstetric emergencies, including postpartum hemorrhage and pre-eclampsia and obstetric labor. According to the Ministry of Health, the combined investment in medical equipment and the specialized training is expected to improve emergency response during the childbirth and reduce preventable maternal and newborn deaths and strengthen reproductive health services in the beneficiary districts. Now, the government says that the partnerships with the development organizations such as Rotary continue to and play an important role in complementing nationals' efforts to improve healthcare delivery and ensure that more mothers and newborns receive safe, quality, and timely medical care across Uganda at large. Now, moving on from that story to our next last story for today. Now, the World Health Assembly calls for stronger parliamentary action on the pandemic preparedness and health financing. Now, health leaders and parliamentarians from across the world have renewed calls for stronger political commitment to the pandemic preparedness and sustainable healthcare financing. This during the Global Parliamentary Forum held alongside the 69th World Health Assembly. Now, this forum brought together parliamentarians and government representatives, civil society organizations, and the development partners to strengthen parliamentary leadership in implementing the World Health Organization Pandemic Agreement and improving long-term investment in the national health systems. Now, the annual forum was jointly organized by the World Health Organization and the Inter-Parliamentary Union under the theme From Commitment to Action, advancing the parliamentary leadership for the WHO's pandemic agreement implementation and sustainable financing for health. Now, this meeting focused on the critical role parliaments play in turning the global health commitments into the practical action through the legislation, policy formulation, budget approval, and the government oversight. Now, opening the forum, the Interparliamentary Union Secretary General Martin emphasized that financing healthcare should not only be viewed as only a technical issue, but also as a political and moral responsibility. He noted that investing in healthcare strengthens national security and promotes economic stability and contributes to the sustainable development, urging governments to prioritize adequate funding for the healthcare systems. Now, delegates also received an update on the progress towards implementing the World Health Organization pandemic agreement, including the ongoing negotiations on the pathogen access and the benefit sharing framework, which is expected to improve international cooperation during the future disease outbreaks. Now, health experts expressed that national parliaments will play a central role in approving, ratifying, and implementing the agreement once the negotiations are concluded. Now, the World Health Organization also highlighted the importance of sustainable domestic financing to strengthen health systems and improve countries' preparedness for future pandemics and other public health emergencies. Now, participants discussed practical ways governments can mobilize additional resources for healthcare, including the introduction to health-related taxes that both improve public health outcomes and generate revenue to support the medical services. Now, the forum also had experiences from the legislators representing Egypt and the Republic of Korea, who also shared how parliamentary leadership can strengthen healthcare systems through the effective legislation, adequate budget allocation, and continued political support for the health programs. Now, civil society organizations also called for closer collaboration between the government, parliaments, and community organizations to ensure that international health commitments result in meaningful improvements in people's lives. And participants agreed that stronger partnerships, greater accountability, and coordinated action across different sectors will be essential in strengthening healthcare systems and improving the preparedness for future global health emergencies. So, in his closing address, World Health Organization Director General Dr. Tedros reminded delegates that international agreements alone cannot save lives without effective implementation at the national level. He said that the parliaments remain the vital link between the global health communities and commitments and the everyday needs for the citizens through the laws they pass, the budgets they approve, and the oversight they provide to the governments. Now, the forum also marked the final World Health Assembly attended by Martin in his capacity as the Secretary General for the Inter-Parliamentary Union, as he concludes his third and final term in this office. Now, health leaders commended his contribution towards strengthening collaboration between the World Health Organization and the Inter-Parliamentary Union and promoting greater parliamentary involvement in the global health governance. Now, the World Health Organization and the Inter-Parliamentary Union have pledged to continue supporting national parliaments in translating these decisions of the World Health Assembly into the concrete action, while encouraging members of the state to include legislations in the future World Health Assembly delegations to strengthen political leadership in advancing global health priorities. Now, dear viewers, that brings us to the end of today's Your Health Updates. So thank you for joining us today. This is a reminder to all of you to remember that good health begins with the informed decision you make and regular medical checkups plus the timely access to the healthcare services. For more health stories and breaking news, keep it on TV1 Uganda and follow us all across our digital platforms, including Innovation Link, an app that where you can find this information from. So I am your host, Kaites Elizabeth, and thank you for watching. Let's meet again today and have a healthy day.
Get ready to power your weekend This is where talent meets creativity, where ideas spark, and where the youth takes center stage. Introducing Youth Hub, the ultimate destination for inspiration, entertainment, and real conversations that matter. From trending topics and hot interviews to music, lifestyle, and everything shaping the next generation, we've got it all right here. So don't miss out. Join the movement, join the vibe, join the Youth Hub every Saturday from 9 a.m. to 11 a.m. only on TV1. See the difference. Don't miss on TV1.
Ebyenfuna, ebyenjigiriza, saako ebyobulamu, byonna byetoolera mu byobufuzi. Bakulembeze bangi be twalonda.